So a couple things that we want to do. One's going to be releasing our hip flexors and then getting more strength into our glutes. Other one's going to be strengthening our abdominal muscles, core muscles, and releasing the lower back a little bit. So we will start with the hip flexors. Basically what you're going to do, take that ball, you're going to find the top bony part of your hip, go about a hand width down from there, and you'll feel kind of that bulky muscle there, and we want to roll just off the side of that. So that's your TFL, roll just onto the back side of that. You got glute coming in here, and there's kind of like a little valley along the edge here. So that's what you want to roll on, or just a little bit onto the TFL. Basically wherever you find that most tender spot in there, you'll find one. So quickly, what that's going to look like is I'm going to take that ball on this side, I'm going to go down a little bit more, and I'm going to go to my body about a 45-degree angle and just slide up and down there until you find that spot, which for me is about right here. And then you just lay into that for a little while. Try and breathe through it. Spend a minute or 2 minutes here, and then do the same thing over on the other side. And then from that one, we'll go straight into a stretch for it. So that's basically just going to be that lunge position. So basically like here, you want this, obviously be about 90 degrees here, and just sitting up nice and straight, and you'll feel a pull through the front of this leg, whether that's your quad, your hip flexor, kind of in through the abdomen almost a little bit. Wherever it is fine, it's just stretching whatever's tightest first, and then moving from there. And then what you can move into is a more advanced version than that, is basically what's called the couch stretch, where we're going to be bringing this leg up. So if I move us over a little bit here, I have a wall there now, and you can see if I come down to here and I put this leg up against the wall, then I'm able to bring this leg up. You might not be able to get all the way up at the start, but just work your way up over time. So starting here, eventually you might get to here. I'm pretty tight today, so this is actually about as far as I'm getting. And you want to do it without getting compensation through your back. So you'll see as I come up, I can get up there further, but I start to compensate through my back. So today I'm stuck about here because I've been doing lots of running and stuff, and I haven't had enough time working on my quads. So I'm going to be here. Ideally what we want to get to is up to here without getting that compensation through the back. And again, you spend about 2 to 3 minutes in that. If you can get to the point where you can get all the way up there, then you can start adding in squeezing your glute muscle. Hold that for a couple seconds, then relax and try and get more of a stretch through it, and even bringing that arm up overhead and moving it around to get a stretch through a longer line of tissue. And that'll be kind of the mobility work that you'll do on the front side. Then you'll take your ball, and on your back side here, basically you'll find top of your hips right here and the lower part of your ribcage there, just a little space in there. Then you're going to move around to the back side, and you'll find that main big strip of muscle there. And if we roll just off the edge of that and take into consideration the height from the ribs to the hips, that's basically where we want to be on the outside edge of that, so about here. And instead of driving the ball straight in, we're going to drive it at a 45-degree angle in. So what that's going to look like, best way to do that is if you have a chair and you can put your legs up on the chair, which I don't have with me right now, so I'm just going to do it without a chair. But basically, your legs would be up on a chair at 90 degrees. You take that ball between the hips and the ribs, and then put some pressure into there, and kind of start off with my body. You see how it's kind of angled to the side of it? Start there, and then you rotate back towards that center line as you drive that ball in. So the idea there is not to go directly over that main strip of muscle and try and punch all the way through it to the deeper muscle that we're trying to get to, but to get in from the side and then bring it across so that we don't have to deal with all that other tissue. But rolling through there, or getting the ball in through there, and then of course you can take a foam roller, or what I got is just a Nalgene, and roll your lower back as well. Focus on just doing one side at a time and not getting a whole bunch of pressure onto your spine. But this is just going to help release your erectors and do a nice slow controlled roll versus rolling over it super fast. And just look for points that are a little bit tighter than others, and then spend more time there, roll back and forth on those a bit more. You can even rotate a bit side to side on it, and really focus on the lower back with that. And then you'll follow that stretching up with one just into your classic child's pose there. And then the other one being, basically you're gonna go nice wide stance, and you're gonna tip over, and you'll feel this through the lower back on this side. And then you'll reverse that going the other way. Alternatively, you can kind of hinge forward and then do sweeping motions coming around side to side. So same stretch, just a little bit more active through there. So what that looks like from the side is you're just tipping over. And you're going side to side like that. And then next what we want to do is foam roll out our glutes. So the lacrosse ball, a softball if you have it, and you need something a little bit bigger and not quite as hard on your tissue. Basically what you're going to do is just anywhere within that whole glute area, just find sore spots in there and work on them. You can start with your legs, kind of how you can see mine are here, and work into those fine spots that are sore and just sit in them like I found one here, and spend a minute or until you feel it dissipate through there. And then if you want to progress that, you can bring this leg up onto the other one. And again, just find sore spots and work through them. And what you can also do is think about squeezing that muscle really tight and trying to push that ball out, and then relaxing into it and trying to let it sink as deep as possible from there. So that's using like a contract and relax method of squeezing that muscle hard and then relaxing as much and as deep into the ball as you possibly can. And through those ones especially, you might feel the muscle like little twitches, jumps, kind of releasing feel, and that's good and normal. If you feel a very nervy feel coming down your leg, you might just be in a spot where you're putting a little bit of pressure on your sciatic nerve, so just move a little away from that. Not that it's going to do a whole bunch of damage, it's just not going to be comfortable to be on there for that time. So just find spots where you're getting like sore spots, but not necessarily a nervy feel all the way down the leg. If you feel a little like radiating discomfort down the leg a little bit, not as big of a deal, but if you feel it all the way down to the foot, don't just move off that one a little bit. But if it's just radiating in this kind of area, that's fine. That can just be referral pattern from the muscle. And then from there, what you'll do is just a glute bridge. So we'll actually flip this around for you. So you're going to take your band, put it up just above your knees, and this is going to create pressure driving inwards and trying to squeeze your knees together, which forces your body to work harder and recognize that it needs to push outwards more. So you go feet a little about shoulder width apart, you drop down here, and then what you want to do is just lift your hips up until then you get a nice straight line. You don't need to go way over past it, and you don't want to be down here. You just want to be at about where you're making a straight line through everything, and then pushing those knees out into the band. Versus if I'm just collapsed, it would look like that, right? We want to push out into that band, and then hold it at the top for 3 seconds, drop back down, all the way up, hold for 3 seconds, drop back down. And our progression of that, once we're ready for it, will be to get rid of the band and just be doing single leg ones. So that's going to look like this. Just so that you know. And then lastly, when we do any squatting, we can take that band and we can wrap it. I like to go just above my knees. Some people will go just below the knees. And then when we squat, this is going to force us to push out into that band again instead of letting it collapse us down like that. That's where we get a lot of knee problems. We want to push them out. Because when you're squatting or anything with the knee isn't a joint that's meant to move a whole bunch. It's a pretty straight joint. So like this is what it's designed to do. So then if we cave that in, it still wants to drive in a straight line. And now we're forcing that tension to kind of go around it. So think about the knee as like we don't want it to be a roundabout. Like if we're talking like traffic circle kind of thing, we don't want it to be a roundabout where to go straight through. That tension has to, and that load has to go take that little detour around the roundabout. We want it so that it's like a light where you can just go straight through it.